since May 31st, as multiple COVID infections were found. The 2 weeks period can be quite long, but there is the best solution to slow down the spread of the virus in the community. We know that the COVID-19 was spreading fast in the rural area and urged people to be extra cautious. You can even transmit COVID-19 before you start showing symptoms or without ever developing symptoms. Therefore, the more we shall prevent and self-aware, the more we can protect ourselves and the community. For us, your health and safety are always our top priority. We have been trying to create more and more activity which bring the best awareness to our valued client. We are delighted to invite you to join today's topic, the COVID vaccine, which hosted by Marshall March, Benefit, and My Doc. Hope you all enjoy it and maintain your best health in life and be safe. Let's hand over the mic to our speaker today, Dr. Matthew Lee, My Doc Director of Clinical Operations. Good afternoon, doctor.
Hi, thank you so much. Hi, thank you so much for the introductions. It's really an honor to be here, to be sharing this very important information with all of you. My colleagues in Vietnam has kindly arranged this sharing. And I think this couldn't come at a more appropriate time when we see a significant surge in the cases in Vietnam. So I think this is a very important topic that I'm sharing today. So what I'm hoping is, you can not just, take it and for your own benefit, but you can also help spread the message to your loved ones and also to your colleagues to encourage them to actually go for the COVID-19 vaccinations. So my name is Matthew. I am the Director of Clinical Operations at MyDoc. I'm based at Singapore. I'm actually a trained public health specialist, specializing in health policy and management and also epidemiology. So right now I oversee the operations at MyDoc in Singapore and also the regional countries. All right. Okay, so this is an outline of my sharing. So I'll be sharing with you some of the COVID-19 status update in Vietnam, the types of vaccines that's available right now, and the latest update regarding these vaccines, and some of the real-world data, which I'm sure lots of you will be very interested in, and also finally answering the questions of, am I suitable for the COVID-19 vaccine? So Vietnam, since the outbreak of COVID-19 in China, and also when WHO declared COVID-19 as a global pandemic, Vietnam have been doing very well in terms of controlling the cases and also the mortality in the country. So up until about March this year, Vietnam has only accrued about 3,000 to 4,000 of cases. But things have changed quickly since April. Until now, we have seen a significant surge in terms of the cases in Vietnam. As you can see here on my screen, you can see over the period of 1 year, the last year, 2020, it has largely remained flat in terms of the cases and death. But as we hit April and then May, there is a significant surge in terms of number of cases. So people have put down this to a few reasons, right? So it could be a loose quarantine protocols, and there was also evidence of poor management at the quarantine facilities where the visitors, the people who are under quarantine, spread the virus to the hotel workers. And another reason is because of the very low vaccination rate in Vietnam right now, which is just around 1%. In Singapore, we are about 30+% right now. And in Israel, we have almost close to 60%. And also this virus variant of concern. So we all know what's going on in India right now. So this particular strain B1617 from India actually has very high infectivity rate. That means it can spread to people easily. And based on the latest data, the numbers of people that this virus can spread as compared to the original virus strain from China is almost 2 to 3 times. So this has created the perfect storm in Vietnam. So that's why you guys are under lockdown, which is a very smart move and the right move by the government. And not just Vietnam. If you look at our neighbors in these regions, Malaysia right now has one of the highest infection rates in the world. You can see it just remains high and not coming down. And countries like Thailand, who are doing so well and also facing the same issue like Vietnam and also Cambodia as well. I think part of the reason is also because of the border. So the border can be quite porous, for example, between Cambodia and Thailand. So it can be quite difficult to control the movement of people and the spreading of the viruses. Now, this is a very interesting graph. It's called vaccine hesitancy. So basically, vaccine hesitancy means any person who is actually reluctant or refuse to take vaccines when vaccines is available to them. Now, if you look at the timeline of these studies, survey done by YouGov from December last year to May 10, you can see the change in attitude. So one of the very remarkable findings you can see here is as the number of cases go up, as you can see all the way to May 10, the people's attitude also change. People are actually more readily to accept vaccines. So I think this is the case in Vietnam as well. So this is the starting point around 60%, back in December. But in the early May, when it was conducted again, the population in Vietnam are generally a lot more receptive to taking up the vaccines. So which is a good thing. Now, before I share with you about the information about COVID-19 vaccines, we can see what happens for the past a year or so. It's actually demonstrations of what we call this a global village. Globalizations, the world is flat. So this is a point proven by this pandemic. It is a faith that's shared by all mankind across all the countries in the world. No one is spared. Now, coronavirus is not something new. All this pandemic is not something new. If you look at just 20 plus years ago, until now, we have seen a lot of different outbreaks, different types of emerging diseases. For example, the Nipah virus that was found in Malaysia, all the way, to the Ebola, to Middle East coronavirus, the MERS. So now we have COVID-19. So what I'm trying to drive at is, as the technology progress, as people progress, as we know about deforestation, all this damage to our environment, pollutions, when there's increase in contact between humans and the environments and the animals, the risk of microorganisms, bacteria or viruses jump across a species, for example, from a bat to human increase, right? So there's this thing, the scientists call it disease X. So it could be a disease that is unknown, but it might come up in the future that could be more lethal, more infectious than COVID-19. So it's something that we need to think about, especially the governments, even the payers in the private sectors like insurers, all this. So I think I'm trying to drive the point that, we are living in an environment that is interconnected. So there's this concept called One Health that's very important. I think the governments and the private sectors, they are more aware of, environments, protections, all this. I think this is important, not just for bringing down pollutions, right? But it's also for this tackling the diseases. So animal health, environments, and also human, these are a same interface. They interact with each other. So if one part of the system is unwell, it can actually spread it to another systems, right? So everything is under the same circle. Now, the rest of my presentation.
Chút xíu. Alo.
Yes.
Từ đợi em tắt cái bên đây cái em đang nghe bên.
Okay, Right, so someone forgot to mute her mic. That's fine. I think this is a very common thing we see right now in this pandemic, Zoom meeting. Okay, right. So the rest of my presentations, I'm going to focus on COVID-19 vaccines. You can see in the graph, so these are the few very common types of vaccine that's available right now. The Pfizer and the Moderna, mainly from US, and then we have the AstraZeneca, or people call it Oxford vaccines, and then we have the Johnson and Johnson. It's actually under their subsidiaries called Janssen, and we also have the vaccines from China, the Sinovac, and also the one from Russia, the Sputnik V. So these are the four main categories of vaccines, and the way they are categorized is actually based on the mechanisms of how these vaccines work. So if you can see the table here, the whole virus is basically technology being applied by Sinovac, the Chinese vaccines. So basically they're using a weakened, or we call it deactivated types of virus or pathogens to actually trigger immune response in you. This is a very common and very mature technology used quite commonly in the flu vaccines. And then we have the protein subunit. This one is a bit rare. So Novavax is the vaccines that's using this technology. And then we have the mRNA vaccines, which is the Pfizer and Moderna vaccines. They are using mRNA molecules that's created in the lab. Basically can code for parts of the SARS-CoV-2 virus, which is the COVID-19 virus, and from that it can actually trigger immune response in your body. And the last one is actually what we call a viral vector vaccines, right? So a vector is basically like a vehicle, like a transport, like a car in your body, where this vector actually is what we call adenovirus. It's a type of virus. It's not a COVID-19 virus, but it's a type of virus that is harmless to the persons. It actually carries part of the spike protein from the COVID-19 in your body, and through that can trigger immune response in your body to achieve the immunity. Now, most of the vaccines require 2 doses. The reason why you require 2 doses is because 1 dose is not enough to actually trigger sufficient immune response. Of course, 1 dose can actually has proven to show benefits in terms of symptomatic infections, transmissions, disease severity, all this. But 2 doses can really give you a very strong immune response. And most of them are 2. The only one with 1 dose is actually the Johnson & Johnson, the Janssen vaccines. And the manufacturers stated here, so we have the Sinopharm, the Sinovac using the whole virus, the Novavax, not so common. Later I'll show you which country using what vaccines. And then the mRNA is very popular, widely used in US. And then we have the last one, which is the Oxford AstraZeneca, the Johnson & Johnson, and also the Sputnik V, the Russia virus, also using the same technology. Now, in terms of efficacy, so efficacy, you see in the media, scientists or even the government officials try to throw around this term efficacy. So what does efficacy mean? And what does it mean in this case for COVID-19 vaccine? So efficacy is basically to describe the effectiveness of the vaccine under a clinical trial environment. Okay, so clinical trial means it is a controlled environment, right? For those of you with scientific backgrounds, you know how clinical trials are being conducted. There is a strict protocols in terms of who is eligible and who should be excluded from trials. So it is a controlled environment. So under this environment, they do the studies. They are trying to identify what's the effectiveness of the efficacy. So if we look at the efficacy for all these different types of vaccines, for the China one, is actually quite a wide range from 50% to 90%, 91%. So it's being done at different countries and in different settings. That's why you get this such a wide range of efficacy. So the 50% study is actually from Brazil, so being done in Brazilian hospitals. So we know Brazil, up until now, they actually have very rampant COVID-19 infections going on. They have the P1 strain, which is one of the very potent strains of COVID-19 virus, and it's being done in the hospital. So that means more people, more of the study subject are subjected or exposed to this virus. So as compared to some of other clinical trials for the vaccines that are being done in the general population. So it's not a straightforward apple to apple connections, right? But for some of other studies being done in the Middle East, in the general population, it actually yielded a very encouraging results, which is 91%. So in order to qualify as a effective vaccines based on WHO criteria, you have to be at least above 50%. Okay. But one thing to know about the Chinese vaccine Sinovac is clinical trial is 100% at preventing severe COVID infections. That means ICU admissions and death. Now, the reason why I'm sharing quite a lot about this Sinovac is also because of the development in Vietnam. Now the government officials are actually open to the idea of bringing in the Sinovac vaccines to Vietnam. Now, we know the mRNA vaccines, the Pfizer, Moderna are very effective, not just to the original strain of COVID-19, but also to the mutated variants. Now, as for the Oxford vaccines and the J&J, they are not bad, 70+%, sometimes also around 80%. And the Sputnik V has very good results above 90%. And actually, as this is, again, as I mentioned, under the controlled clinical trial environments, when you roll out to the real world, when you roll out, in the countries, the numbers can change a little bit. So the numbers is actually affected by the types of variants out there, right? So we all know now there's strains from UK, from South Africa, now the latest one from India. Now there's even a latest one reported by the Vietnam officials just last weekend, that it's a combinations of the UK and also the India strains discovered in Vietnam. But I think till now, the government has not released the genetic informations online yet. So we are still waiting to see actually what is the impact of these infections for this strain that was discovered in Vietnam recently. And also depends on the host capacity, right? So another thing about this efficacy, when we say like 90% or 50%, what does it mean? So basically it just means if it is 90%, that means maybe if you look at 100 people, for example, 10 people might develop some kind of symptoms and they might get infected. Or if you look at individual, that means there is a 91% chance if you're exposed to the virus, you don't get infected by the virus. Yeah. So it's very important, right, to remember getting the COVID vaccines doesn't mean that you won't get infected. There is still a chance that you can be infected, right? It depends on the host immune response. So by that, it's very important to remember COVID-19 vaccine is not the panacea, okay? We still need all these measures. We still need masks. We still need all these sanitations, hand washing, sterilization. We still need the social distancing until we really reach a very, very high level of vaccinations. Now, this is a summary of the vaccines. I mentioned the 4 types of vaccines, the most popular type. Of course, right now, there are almost 200 vaccines that's under clinical trial in the pipeline, and it could be, available in the future. But the popular one, the main ones are listed here. So in Vietnam right now, the only one that's being used is actually the AstraZeneca, and I think the government has also approved the Russia vaccines, and the government is the Vietnam government is looking to bring in Pfizer, Moderna, and also the Sinovac vaccines. Okay, so it's a quick updates in terms of the number of vaccine shots being given to date. So the latest figure, based on 2 days ago, 1st of June, 117 countries have already started vaccination programs. So the dark greens means higher density of population receive the vaccines. The lighter greens means lower rate of vaccinations. So we can see the rich countries, the Western countries, they have very high vaccination rates. So today, almost 2 billion shots been given. So that's about 12.7% of the global populations. So it's at the same time, there's also challenges facing this global vaccine distributions. When we mention about herd immunity orders, what we can see is there's a disparity in terms of the distribution of vaccines, where the high income and upper middle income countries are getting the lion's share of the vaccines. This is the number here you are seeing is actually the number of people vaccinated per 100 people, okay? So the high income, middle income taking the lion's share, and whereas the lower income really not even 1% per 100 people vaccinated, and lower middle income is only 8% per 100 people. So it's very uneven. So this will have a lot of impact in terms of traveling, in terms of businesses. So when economy reopen, it will also be a very unequal reopening at different parts of the world. So WHO COVAX initiative is actually trying to help to make vaccines available to low and also middle income countries. I think Vietnam also working very closely with COVAX initiative. Now, you are looking at here is basically the graph from Israel. So Israel to date has vaccinated the highest, one of the countries with the highest number of vaccinations in the populations. I think Seychelles is another one. So for Israel, because they have struck a deal with Pfizer, BioNTech very early on, so they get hold of the vaccines very early in January. So they started this very aggressive vaccination campaign in the country. And so you can see, so it started here, okay, all the way up to 31st of May. So they have vaccinated, fully vaccinated is 56%. So it's close to 60%. And people who receive at least one dose is actually 60%. So as I mentioned just now, even one dose of vaccines actually already can show the benefits. Now, when they reach this level of vaccination, you can see it actually has a very, very big impact in terms of the new cases and also the mortality rate. So you can track keeping everything equal, right? The country is still under lockdown, there's still movement control, everything equal. Just by vaccinating people, you are actually able to bring down the cases and also the death rate significantly over a very short period of time. So from close to 10,000, okay, in January to now just 6 per day with a 7-day average of 16 and the death of about 100 per day to a 7-day average of just 1 death. So you can see the very, very big significant impact of vaccines in tackling COVID infections. So this is a very good example of a real-world efficacy of a vaccine. And Pfizer, Moderna, BioNTech vaccines are actually very effective, not just to the original strain from Wuhan, China, but also to the strains from UK and South Africa. Yeah. Now, this is a summary of the benefits of the vaccines. So it decreased symptomatic disease, it decreased severe disease and also death. It actually decreased the viral loads up to 20 times. Okay, so viral loads can actually, the higher the viral load, that means there's a higher chance of you getting sick. And it also brings down the transmissions by almost 2/3. And this is proven just after 1 dose. So even if you are infected, after vaccinations, the viral shedding, the durations and the amount is a lot lesser compared to someone who is not vaccinated. So this is a real-world data collected in different countries. So in Israel, as you can see from the graph and the figures here, there is a significant decrease in infections after 2 doses. up to 96%, up to 98% in terms of the symptomatic cases, and also almost 100% in prevention of severe COVID-19 infections that require oxygen, ICU admissions, and death. And as for the Oxford AstraZeneca vaccines, the one that was given in your country right now, we can see a very high effective rates as well. This figure from Scotland, 95, almost 95% decrease in hospitalizations, even for those above 80 years old as well. And in United States, it tells the same story as well. So just one dose of vaccine has proven to be able to bring down the infections and increasing the neutralizing antibody, which is the antibody that's required to tackle the COVID-19 virus. So what about the side effect? I know there's a lot of vaccine hesitancy, right? So there's vaccine hesitancy can be contributed by different factors. So one of the biggest reason for vaccine hesitancy is actually misinformations. We heard about fake news, rumors that's out there that's giving us wrong information and causing people to have this fear of going for the vaccinations. So this slide is the following slides is actually to explain to you, what is actually the real impact of a side effect of these COVID-19 vaccines. So a lot of the time, the media has really overblown the side effect of the vaccine. So the side effect most of the time is actually no different from the side effects of like flu vaccines. So the common ones are like sore arms, low-grade fever, headache, fatigue, feeling tired, and muscle ache. So the reactions are very much similar to a flu vaccine. It's just that in this case, it can be a little bit more severe. You might feel it a little bit more compared to your flu vaccines. And for the AstraZeneca vaccines, we know that it's actually a very low and very rare risk associated with blood clot formations, which I will share more later. So this graph is actually to show you the type of side effects that you experience and comparing the first dose and the second dose. So most of the vaccines out there right now are given in 2 doses. You can see here the orange bar is actually longer for all categories. That means you will experience the side effects like feeling tired, arm pain, body pain. You will experience it more when you had your second dose as compared to your first dose. And the arm pain is the most common side effect you will experience. Up to about 70% of people actually reported arm pains, and also about half of the people reported feeling tired. You can also feel headache, muscle ache, and a small number of people you can experience fever as well, fever, chills, and swelling at the injection sites, and also feeling a little bit nauseous. Now, apart from the blood clot associated with the AstraZeneca, the other side effect that is, I would say, a severe side effect that is widely reported in the media, causing people to worry about it, is anaphylaxis. So anaphylaxis is a type of allergy reactions, but it's not the common allergy reactions that you get, like the skin rashes, but this is a very severe type of allergy reactions where you can even experience breathing difficulty. Now, do you need to worry about anaphylaxis? Now let's look at the data. So we can see this data is actually not the data based on the clinical trials. As you can see, we have already given close to 2 billion shots of vaccines. Okay, so this has never been done before in human history. vaccines being given in such a large amount in such a short period of time. So what does that mean? That means we are able to collect a lot of data. Okay, so this figure that you are looking at here is actually derived from this large quantity of data. So for Pfizer-BioNTech, the rate of anaphylaxis is actually very low. It's almost just 2 out of 1 million. For Moderna, it is about the same, 2.8. As for Oxford, AstraZeneca is about 10. Now we have to look at this at a in a different in the real world perspective. Okay, I have to put this in the context for you in terms of the most common one of the most common vaccines that we have right now, which is the flu vaccines. So what does it say about anaphylaxis rates in flu vaccines? It's actually about 1.3 to 11.1. So it can be even higher than your Oxford AstraZeneca vaccines. And almost all the vaccines anaphylaxis reactions happen within 30 minutes. So up to 90% of people who actually have anaphylaxis towards the vaccines, actually it happens 30 minutes after they receive the vaccines. So that's why after you receive the vaccines in the center, the people there will actually keep you monitor, up to an hour or 30 minutes, just to make sure nothing happens to you. So almost 100% of the anaphylaxis actually happen 1 hour after injection. So if you're worried, you can stay on in the center for more than an hour to make sure you are fine, you are well before you leave the center after your vaccines. Now I want to address people concerned regarding the AstraZeneca vaccines. Not just AstraZeneca, this side effect is also being reported in the J&J, the Janssen vaccines as well, which is using the viral vector technology. So this blood clot side effect is actually caused by one of the proteins in the vaccines. So they have actually able to identify the culprits, the root cause of the blood clots. So that is a good news for us. That means once they identify the problem, the root cause, they can actually implement measures to actually remove or put in measures, put in solutions, so that in the new batch, the new version of the vaccines, we can either eliminate the blood clot side effect, or we can bring it to a very, very, very even lower level of incidence. Now, based on the data from UK, the MHRA, the Medicines and Healthcare Products Regulatory Agency, the rate for the side effect is actually very, very low. So to put this into context, into perspective, we can compare it with the blood clot you can get with COVID-19 infections. Okay, so COVID-19, we are still finding out more and more about this virus. I mean, to be fair, we have only known this virus for a year plus, since December 2019. So it's only about a year and a half. So we are still trying to get to know this enemy, right? So we know quite a bit right now, and we know COVID-19 can actually cause blood clot formations, and the rate is very high. It's about 16.5% of people infected actually presented with this blood clot complications. And almost 1/3 of people infected with COVID actually have this thing called long COVID. So long COVID is someone who actually still suffer from the COVID symptoms, the COVID problem 6 months after infection. So we can see, it's a very serious matter, about this COVID-19 infections. So blood clot can also form during pregnancy. So it's about 1%. And also from smoking, there's about 0.18%. Whereas if you compare all this with the AstraZeneca vaccines, the side effect is actually very low. It is about 4 in the millions. So it is very, very low. So as we administer more and more vaccines, we will know more and more about the side effects. And my belief is the rate will go even lower. So why are people concerned about this blood clot? Of course, this blood clot is actually very rare, but one type of the blood clot which affects the brain can be quite serious, but again the rate is very, very, very low. And also another thing I will want to highlight is when you look at all these rates, all these numbers, not just you have to look at it from a you have to put this into perspective, but you also have to look at the current situations to actually help you to make a cost and the risk benefit analysis. So when you look at the COVID situations in your country, in your community, if the COVID situation is bad, if your community has very high COVID-19 infections, then you have to actually compare these two figures, right? You have to compare 16.5% against this 0.0004%. So you have to try to make sense in order to help you to make this risk-benefit analysis. So it's actually very fluid. So if you do go for the vaccines, go for AstraZeneca, in a very, 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 very rare unlikely events, you might suffer from some of these symptoms, this side effect. Then you need to look out for these type of side effects. Then you need to, present yourself to the hospital as soon as possible. So it is also good because right now we know what are the side effects associated with different types of vaccines. We can help to educate the people so that when they receive the vaccines, they know what are the things to look out for. So for people who are not suitable for the AstraZeneca vaccines, are people who have had, a previous blood clot incidents, all right? The medical terms is a heparin-induced thrombocytopenia, or you have had blood clots in your brain before, and anyone who actually experienced some kind of blood clot formations after the first dose should not receive the second dose. So another thing about vaccine hesitancy is some people are asking, is it safe, right? Because it takes a long time to develop vaccines, 5 years, some 10 years. But right now, after just 1 year, we have so many vaccines that's available. So I just want to say that actually coronavirus is not new to us. So coronavirus was first discovered in the 1960s. So since then, the scientists has actually been working very diligently on this coronavirus, trying to find solutions, trying to find vaccines for this virus. So, they are no stranger to us, okay? And things like the mRNA vaccines, the mRNA technology, although this is the first time being used in the real world, but this is not a new technology. It's been under research since about 40 years ago. And there's a lot of support from the public and private partnerships, the financial support as well. So as I mentioned, a lot of this vaccine that's out there, the technology has been around for many years. So this is not something that's just being put together in a year. So you don't really have to worry so much about this safety profile. And also there is a lot of data out there right now because we have close to 2 billion of vaccines given in the world. And because there's a lot of countries with high number of cases around the world, so clinical trials was basically a walk in the park last year. So that's why we are able to have all this safety data out so quickly in such a short period of time. So this is the last part of my presentations. So who can and cannot take the vaccines? So if you have history of allergy reaction, as I mentioned, anaphylaxis. So if you have history of anaphylaxis to any vaccines in the past, then you probably shouldn't take the vaccines, especially the Pfizer vaccines. You should consult your doctor. You can go for other type of vaccines such as the Sinovac vaccines, or this, which I think will be available in Vietnam quite soon. So if your allergy is just skin reaction, rashes, then you don't have to worry so much. Now, anaphylaxis is basically swelling of all these eyes, lips, breathing difficulties, and also feeling dizziness. People living with cancer, so people who are actually undergoing active chemotherapy for cancer treatment, radiotherapy, or immunotherapy, they should not take the vaccine right now. They should complete their therapy first, then only go for the vaccines. So people who are on hormonal cancer therapy can be vaccinated. People who have a history of cancer, but right now is already in remissions and no plan for any chemotherapy or radiotherapy, they can be vaccinated. So people who are on dialysis, people who have Parkinson's, dementia, thyroid diseases, heart disease, stroke, lung disease, liver disease, hepatitis B, diabetes, hypertension, hyperlipidemia, all these people are actually okay to go for the vaccines. Of course, before you go for the vaccines, you register, and then the governments, the doctors, nurses will also go through with you again before you receive the vaccine to make sure that you meet all the criteria before they give you the vaccines. Okay, so that's the end of my presentations. Now, thank you so much for your attention. So right now is actually the Q&A session. So if you have any questions, you can just open your mic. You can ask me. Yeah. So I will also just want to add on, with all these new variants, these mutated strains out there right now in India, now in Vietnam, that is getting a lot of attention in Vietnam because the Ministry of Health Vietnam shared that it was actually a combination of UK and India strain. So people have concerns. Of course, we want to roll out the vaccines as soon as possible. I think in Vietnam, the government's mentioned that they want to bring in about 150 million of doses this year to vaccinate about 70% of the population. So there's this thing in the public's mind, which is the herd immunity, right? So is it 60%, 70 or 80% herd immunity? So herd immunity means when you vaccinate a certain number, proportion of the populations, then you reach such a stage that the virus can no longer be spreading around in the community effectively. So effectively means you actually, put a stop to the virus transmission. So this is actually affected by, different factors, right? So one of the important factors is actually the virus strain. So we know we don't have a lot of data now that there's another strains found in Vietnam. We don't have a lot of data information in terms of how effective are these vaccines against this virus strain. So that will actually have an impact in terms of how many percent of our populations need to be vaccinated in order to achieve herd immunity. But one thing for sure, right, is we are actually raising together we are raising against the virus. Okay, we are raising against COVID-19. So the more people getting vaccinated in the shortest possible time, that means we can really bring down the number of infections in the community. So why do we have so many mutated strains of COVID-19? One of the reasons is because there are just too many cases in the community. There are just too high level of infections. So every transmission from one person to another is actually a risk for the virus to actually mutate. Okay, can become stronger or can become weaker. So the right thing to do is to vaccinate as many people as quickly as possible. So my message to you today is go out, spread the message, and go for the vaccinations. Yeah.
Thank you, doctors.
Thanks.
We also have some question at the chat box. So can you go through it and inform more information for the audience?
Okay. Okay. Redon's visibility when we get the vaccination in Vietnam. So this, okay, I can't comment too much because I base at Singapore. I don't base at Vietnam, but I'll try to answer to the best of my knowledge. I think it's a very fluid situation. I show you the graph. Right now, the epicenter of COVID-19 sort of shifted from the Western countries now to Asia, in particular the South Asia, India, and now Southeast Asia, Vietnam, Malaysia, even Singapore. We just started another round of lockdown just about 3 weeks ago. So now this has changed the dynamics in terms of the vaccine distributions, and people are now more aggressive in terms of fighting for the for the vaccines. And WHO COVAX initiative also having a hard time in terms of distributing, how many to give to this country or that country, because now almost all countries are undergoing a spike in the cases. I think the government is very proactive in Vietnam, very proactive. I mean, as they have always been since last year, as we can see, and they are now working very diligently with the providers. They were working very closely with US, bringing the Pfizer, Moderna, and they are also thinking about bringing in the China vaccines as well. And also they are also discussing with COVAX, WHO, to actually build a plant, a manufacturing plant in Vietnam, so that they can produce themselves. I mean, in Malaysia, the pharma company in Malaysia has actually struck a deal with Sinovac. So Malaysia, this pharma company can actually start producing Sinovac, I think in July, next month onwards. So it's actually a strong boost for this war against COVID-19. So I see very positive development in Vietnam in terms of vaccinations, and the government, I think, also promised to bring in 150 million doses of vaccines in Vietnam to vaccinate 70% of populations. So I with the will, with the determination, I think this can happen in Vietnam. And also the private sectors have come out to say, just open the doors. We want to help. We want to bring in the vaccines as well, to benefit the Vietnam people. So yeah, so great. So 50 million in Q3, another 50 million in Q4, and 5 million, no commitment of delivery date. So I think this is very, very positive. Yeah, and I think a very positive development is also the government. I mean, because of these geopolitical sensitivities, I think the government is also taking a very smart move. Is not being really being pulled inside this whole geopolitical sensitivities. They are really being smart, open up to all, for actually in the best interest of the people. So talking to different people, even to Russia, to China as well. So, okay, now this question is very good. I'm glad you asked. So after 2 doses of vaccines, how long do we need to take the next round of vaccinations? So yes, correct. We need to we of course there is a need to vaccinate again. So in terms of these questions, the data is not very complete. Now there are 2 groups of people. So there's a group of people who have had COVID infection before, and then there's another group who never had infections, and their immunity is derived from the vaccination. So even for these people who have had COVID-19 infection before, in terms of the immunity post-infection, it is actually a wide spectrum. It's a wide spectrum, and because we only know the disease, the virus, for 1.5 years. So we can only make projections. Okay, so scientists have made projections based on this study. So make projections. So some people, based on the level of antibodies, they project that they don't need vaccinations, right? They project they can, the immunity can probably last a lifetime. Some people, the projection probably only lasts for a few months. That's why you have cases of reinfections. Okay. Now on the other group, people who receive the vaccines, so exactly how long is the immunity period? So we don't have very concrete data as well. So I think the Pfizer CEO actually suggested a 3rd dose, a booster dose, a year after the 2nd dose. So we don't have a lot of data. So this part is still undergoing research right now. Also need to bear in mind all these new strain, all these mutated strains. So the best solution moving forward right now is to get vaccinated as quickly as possible, so that we can really put a stop to the old strain and also to the new strain. So yeah, so we just have to watch out in this space. So how normal people get vaccine, how much per dose? So so I don't really know the pricing But I believe if this is a government initiative, I believe you'll be free. And then if someone who has the answer, maybe you can share. If not, I think you can probably find this information from your government's directory. And different countries have different pricing depending on the economic status of the country, actually. Yeah. So it seems that Sputnik and AstraZeneca takes long lead time. So are you talking about long lead time for Vietnam to receive the supply? I mean, probably, as I mentioned, because the situation is so fluid, there's outbursts of cases all around Southeast Asia. So people are really fighting for it. That's why we need a multilateral corporations. We need multilateral organizations like WHO to cooperate distributions. I think best is, you can produce your own vaccines. I think there is this. I just want to share with you the real picture on the ground. Early last month, I think early May, Joe Biden came out, the President of the United States, announced that he wants to go for a waiver of the COVID-19 vaccines, the waiver of the COVID-19 patents, actually. That is a good news. That's a great news, not just for US, it's a great news for humanity. I think that should be the way to go. But in real life, this is not so straightforward because there are many hurdles in order to just waive the patent. The waiving of the patent is just, one hurdle, right? The waiving of the patent and together with drug manufacturing, there are multiple steps. The technology being involved to create the vaccines, it will be another patent. Actually, probably do not owned by US, it is probably owned by Germany. So in this case, actually, BioNTech is a German company, and quite a lot of European countries. In fact, German leader is actually against it, and not surprisingly, a lot of these pharma companies are also against the idea. They are not just against the idea. I mean, it's not because they want to profit. I mean, some of them, they actually have very good reasons why they're against this, patent waiver. So in order to cross all these hurdles, it need to be deliberated in WTO. All the member countries need to actually agree for this waiver, not just US, but all these countries concerning all the technology involved for the production of the vaccines. Then only it can go ahead. All right. It's not so straightforward, so it might really take a while. Yeah. So, but I'm hoping for the best, because right now Sinovac has signed a contract. So maybe Pfizer, Moderna, or even like AstraZeneca can sign contract with the Vietnam government to allow local production. I think that would be good news for the country. So I think if you're a foreigner in Vietnam, you will be so far down the list. You'll be lucky if you get this. Okay. The best hope is borders open. Then you can go back to your home country. At least is what I'm hoping for. Okay. It's hard to say, right? It is really hard to say now. It could and it might not happen, okay, because of this thing so-called vaccine passport, right? So this vaccine passport is a very tricky question. It's a very tricky situation. So if all these Western countries have very high rate, for example, like Israel, they now vaccinate almost 60% of the populations. Now they are thinking about opening up their border, but the condition is only those vaccinated can enter Israel. So it becomes very tricky. So some people are against it. So in a way, I can understand where these governments come from. After all, it's for the welfare, for the interest of their people. But in a way, if you look at a global village, globalizations, the whole world, it will be a discrimination against the middle and low income countries. So if you are in low income countries, maybe like some African countries, the vaccine that you receive might be the vaccines from China. And if these European countries don't accept the the Sinovac vaccines, then you will have trouble, right? So then you can't even travel for business reasons. So it's a very delicate and very, sensitive situations that really need all these country leaders to actually work together. Yeah. Okay. So I actually share the presentations.
Dr. Matthew, it seems that we have a lot of questions down here, so maybe we have to answer really quickly.
Okay. Okay. Yeah. Okay. So Pfizer, Moderna is the one that is moving the fastest in terms of doing trials on all the different groups of people, like young people, teenager, pregnancy. I think for Pfizer, Moderna now they're open to people who are pregnant and breastfeeding, and also 12 years old and above. Yeah. So if people recover from COVID-19, does he still need to be vaccinated? I would say yes. Okay. Reason is because we don't know, and it varies from person to person in terms of the durations of how this immunity will last. Okay. Okay. So which vaccines are safer for children below 12 years old? So yeah, it's still ongoing. I think we have to look at US. US is the one that's moving very fast. They are very eager to open the economy. So we know children in schools can get the virus and spread to the family. So I think they are right now looking at below 12 years old in US. Yeah, I think it's just a matter of time when it released to 12 years. So for old people, yes, above 70 years old, you can take. There's no problem. For Pfizer, for AstraZeneca, there's no problem. But of course, just like Singapore, in Vietnam as well, before you take the vaccines, of course, the people at the center will review your health status. Okay, because there are some reports, we hear from Norway, although the association is not strong, but one or two cases of very, very old, very weak, very frail elderly actually pass away after the vaccination. Although I must emphasize, although the association is not strong. Okay, so contact with vaccination, I think Marsh can probably help to answer. Okay, so this is a HR question for Dell. Okay, so immunity duration, I think I shared already, we are not sure. Yeah, so how long does it last? That one I'm not sure. You have to just keep looking for. So right now, based on information, prediction is probably 1.5 to 2 years. So it is quite possible. It is quite possible in the future you will need to receive a COVID-19 vaccine booster on a yearly basis. It is quite possible. Oh no, type 2 diabetes, if your mind is well, type 2 diabetes, yeah, you can go for the vaccine, no problem. Okay, Sinopharm and Sinovac, right now I do not have the data yet, but I think the data is already available because COVAX, as I mentioned, WHO COVAX has already taken in or accepted Sinopharm and Sinovac as one of the chosen vaccines. Yes. So I think I've answered all the questions. All right, so over to you, Huang.
Thanks a lot, Dr. Matthew, for this really really meaningful topics. It's really hard in Vietnam right now for the biggest wave of COVID. So I think that we'll pass back to our organization team. So Phương and Chị Diệu, do you have any other questions, or anyone want to have any other question?
So thanks, Dr. Matthew, for this wonderful presentations. And we have the recording right now file and the presentations informations. So later on we will sum up, and if you have any questions, please send over to us. And thanks for your time today. Thanks, Dr. Matthew.
Okay, thank you everyone. My pleasure. Thank you. Take care and stay safe. Bye.
Bye. Take care.
Bye.
Bye.
Thank you. Bye-bye.